For about 250,000 state and local government employees covered by the State of Wisconsin Group Health Insurance Program, gender reassignment procedures and surgeries are no longer covered.
News 8's Madeline O'Neill is here with more on the change.
Mike and Martha, the Wisconsin Department of Employee Trust Funds, or ETF, excluded gender reassignment procedures from its group health insurance coverage until January this year, when those services were added on based on an interpretation of an Affordable Care Act requirement. But now it has already changed again. Will Van Rosenbeek is the Pride Center Director at UW-La Crosse, helping the LGBT community on campus.
LGBT students, faculty, and staff.
He was looking forward to a January 1st change from the Wisconsin Department of Employee Trust Funds, or ETF, which would allow various transgender healthcare services to be covered under state insurance programs.
I was excited that we were finally to the point where we were going to, allow transgender people that are part of the UW system and the state of Wisconsin to finally feel like they, belong.
But on February 1st, ETF changed its policy back, meaning procedures, services, and supplies related to surgery and sex hormones associated with gender reassignment are again not covered by state insurance programs.
Now this is a setback for people to say, maybe Wisconsin isn't as progressive as I thought it was.
University of Wisconsin's Human Resources Department notified staff of this change by email this week.
I was already aware. My concern is that maybe not everybody was aware.
Without insurance covering his hormone treatments and surgery, Van Rosenbeek has paid out of pocket.
And so we're talking about tens of thousands of dollars.
But he's worried many others can't afford it.
That's scary.
Van Rosenbeek says transgender people struggle with their reflection not matching their true selves.
Your body not matching, your brain and your heart.
And he says gender reassignment services are often necessary for mental health.
If we don't have access to the health care that we need for that, that's very problematic.
According to an ETF document, part of the reason behind the change was a Texas federal judge's injunction barring enforcement of the ACA provision extending anti-discrimination protections to transgender health services, along with an opinion from the Wisconsin Department of Justice. I contacted ETF and they declined an interview, as well as the UW system.
Thanks a lot, Madeline. According to ETF, there is currently no data available on how many people use the coverage for gender reassignment procedures in the 1-month window they were allowed.
There are some numbers here, though. A consultant for the insurance board estimates there would have been an annual cost of about $100,000 to $250,000 for transgender services. That's with a total of $1.3 billion in premiums.